Hello, lovelies. Good day once again. I'm here to bring to you the part two of assisted reproduction technology, aka IVF. For some reason, Ghana we all call assisted reproductive technology IVF. But as I said in our previous video, IVF is very broad. Assisted reproduction is very broad. Assisted reproduction is not all about IVF. Okay, when we talk about assisted reproductive technology, in summary of our previous post, it involves any technology that is applied to help anybody struggling to conceive naturally to conceive. That's what we call the assisted reproductive technology. Okay, and we made mention that some of the procedure that is involved in assisted reproduction technology is what we call the ovarian stimulation, where we stimulate the ovaries, especially in women who are not able to produce egg at all. They menstruate all right, but they're not able to produce egg. The fact that you are menstruating does not mean that you are producing egg, or the fact that you are menstruating as a woman does not mean that you are producing the quantity of egg that is necessary or the quality of egg that is necessary. So normally, depending on the situation, we're able to do what we call assisted ovulation induction to help you produce more egg. Okay, and we can do that to support procedures like IUI and IVF for the treatment. Okay, now as I said earlier on, IUI simply means intrauterine insemination. In that condition, we stimulate the ovaries, or we can choose to stimulate the ovaries, and then we take the man's sperm, we prepare the sperm through a tube, we push the tube through the vagina at the right time to the endometrium. That's the inner lining of the uterus. So actually, the sperm can then swim from there to the egg. We've explained the details on the condition which we're able to do that. Okay, so you can watch our previous video, or you can get more knowledge about it. We also have a technology we call the IVF. And IVF, in the case of IVF, we bring the sperm out. Once we bring the sperm out, we bring the egg also out. We then externally the sperm fertilize the egg, and then when it's about 5 days, we put it back into the woman, which is called as IVF. And we have the IC, the same procedure, but the IC, in the case of the IC, we take the sperm, we push this, we create a hole inside the egg, and we push the sperm inside it, and then the ovulation begins. That is it about the assisted reproduction. The IC, that's about the IC. Okay, and we have the surrogate mother too. And the surrogate mother is a situation where for some reason the woman cannot carry a child or does not want to carry a child. In this case, the woman can choose to give us her egg, or she can get a donor egg, or can use the husband's sperm, or can get a donor sperm. Once we do it, whatever that you give to us, we fertilize it, and then we put it into another woman, and then the other woman will carry the pregnancy to term. Now, it doesn't have to be, but it will be your DNA. If it's the woman's egg, it will be the woman's DNA. If it's your husband's sperm, it will be your husband's DNA. The other woman, surrogate mother, is only a carrier, so there's no DNA crossing over there. It's only a carrier, so your DNA is intact. Okay, and as well say, if you're out there, maybe example somebody outside, when you're outside Ghana, you want to do IVF or assisted production, it's either you can get an embryologist there. An embryologist can put the sperm together first to get the embryo. They can ship the embryo to us. We get a surrogate mother, and then we'll do it for you. Or you can get the egg and then the sperm. We'll do the fertilization for you successfully. Put it in a surrogate mother. Once it is ready, you come for your child. It's legal without any complication. Today, I want us to have a short discussion on the key myth about IVF. Okay, some people have sent me some messages about some myth they have about IVF, and I think that assisted production, and I think that it's important that we handle it. One of the questions people ask is that IVF is only for the rich people. Let me tell you something. IVF is not made for the rich people. This technology is made for each and everybody. Yes, of course, it's on the higher side. However, it is not made for everybody. It's not made for only rich people. Both the middle class, the poor, and then the rich able to do it. That's why some centers like ours, we try to do ours affordable. We have people out there who does the IVF also affordable. We have NGOs assist people to also do IVF at a very affordable rate. Okay, and so it is a technology to help mankind. It's a technology to help those in need of a child. Okay, so it's not a technology that have been invented for only the rich, okay? Only the rich, but the excuse my language, the rich, the poor, the middle class, everybody can benefit from IVF. Someone says that assisted reproductive technology always lead to twin or triplet. Yeah, not necessarily. Assisted reproduction technology, sometimes you can do it, it can even be nil. You will not get any result at all. And most of the time you can get one child. Sometimes you can get two children. So assisted reproductive technology does not necessarily lead to having twins or triplet. That is something that you have to take note of. I have here is that infertility is only a woman's problem. No, infertility is not a woman's problem. Both the man, both the woman can all have issues with infertility. As a matter of fact, most men working out there, look, I always say that when it comes to the men, okay, the fact that you are having sex with all this energy and you are producing semen, this fluid from your penis, doesn't mean that there's sperm in your semen. You may have to do semen analysis to know if the fluid you are producing indeed have sperms in it. And if you have the sperm in it, it's the sperm quality, okay, and the quantity also okay. Okay, we have some women, they don't have any sperm at all, which is called azoospermia, but they have sex and semen will come out. So infertility is not reserved for only women. That is, it is important that when couples need infertility, you come around with as a couple. Don't let the lady go alone. Come around and treat yourself. Together. Someone have here. He says that is it true that ART is for people who don't have faith? No. People, this question is very important. Some people believe that if you have faith in God, whatever God you worship, why do you do IVF? Okay, or assisted reproduction? Now the question is that, listen to me, medicine in itself is faith. Medicine in itself is the grace of God. Medicine in itself, the science of medicine itself is faith. So it is not for people who don't have faith. No, whether you have faith or you don't have faith, you can benefit from assisted reproduction technology. Okay, that is how people do it and can feel. So that is how you can apply your faith that you will do it and it will not feel. Okay, it is very, very important. This brings me to the question about the emotional. This will be a question about the emotional and the spiritual support of assisted reproduction. Frankly speaking, assisted reproduction needs a lot of emotional support. It is not easy, especially on the couples and especially on the woman. Okay, so when it's not just about, like we doctors, just doing assisted reproduction for you. It is about health workers assisting you emotionally, spiritually, psychologically to go through the process. Because it's not like just having sex and then there's a child. No, the woman has to be screened for a number of times, take some injections, monitor before it is done. If you go all through all this and it becomes negative, there's no pregnancy. Psychologically, it's not the best. Okay, so we spiritually, emotionally, that help is always needed. That is why for here we try to psych the woman out. We have clinical psychologists who speak to the patient who really need it to make sure that they are in the right state of mind. And I always say that, look, when it comes to couples who need a child, it's important that the community, especially the church, have some kind of compassion on the couples. Don't put unnecessary pressure on the couples. Help the couples, and also, with love, and then see how best you can help the couples. All right. So this is the end of the part 2 of what assisted reproduction is all about. You can watch the part 1 and then you can have more information. However, if you're out there and you need assistance, okay, as I say, don't wait till you're married and there's no child before you start medical treatment. You're a young woman, young man there, you can come around and do complete health screening for you at a very competitive rate so that you can know your state. As a woman, you have to know the quality of your egg, the reserve of your egg. You have to know your hormones. You have to know your ovaries. What is going on around you? You have to know with them. If there's any problem, you solve it. So with the men too. You have to know what's going on with your testes, your hormones, so that we can help you appropriately. When you come to Kratos Medical and Fertility Center, we guarantee you the professional care and treatment. We will assess you and will give you the best kind of treatment. And whatever treatment we take you through, confidentiality is our hallmark. We personalize your care for you, and we also make sure that the treatment plan that we give you is also very, very friendly. And I end by saying that if you're out there and you have any conditions such as fibroid and you need urgent fibroid treatment, or you think you are fibroid, you are not sure if you are fibroid or not, come around, we'll do the test for you. And if we have to do fibroid surgery for you, we'll do it for you at a very, very affordable rate. Okay, so our number is written down there. Pick it up, call us, book an appointment with me, come here. We have other doctors here. Dr. Sapon is here, Dr. Arif is other doctors here who can assist you. Come around and we'll give you the best of medical care. Thank you very much for your time. Shalom. Bye-bye.